Greetings. As you know, the association has established a theme this year of embracing change, and one of the ways we're embracing change this year is changing up how we're giving you information about the last legislative session. So even though the Minnesota's 2016 legislative session was exceptionally short because it didn't start till March, lasting only 77 calendar days, there were still over 3,000 bills introduced, and ultimately about 100 new laws were signed. Not many of these laws had great impact on the members of this association, so when we talked about how best to give you the information, we decided it's best to give you information two ways. One, we have posted on our website all of the legislative update pages that we wrote summarizing issues that are of interest to you or should be of interest to you that passed last session. They are posted on our website here. You can print off individual pages, you can print off a full book, or we will bind the book for you and provide it for you at your request in a nominal processing fee. We are also going to give you short little snippets on different key issues that we think you should know more about. There are some issues like recodification of nursing home statutes that likely are only of interest to a handful of you that are in the legislative update pages. We're not going to spend time in a long webinar going through those issues. Some of the key issues that we will be covering are issues relating to moratorium funding. For those of you interested in doing some replacement or remodeling projects of your nursing facilities. Some changes to the home care statute. There are some new workforce training grants, and there are changes to some of the issues relating to prescription medication in our settings. There were a lot of bills that were introduced that we advocated for that did not pass. Some of them were converted into interim work groups, and you will hear more about that from us in a variety of ways. So this year, look for us in short little videos and on the web in our legislative update summary. And as always, if you have any questions about any legislative issues, you can contact me directly, and here's my contact information, or you can contact one of our lobbyists. Thanks, have a good day.
So this was an interesting legislative session, lots of work, lots of action, but not much that came out of it, unfortunately. On the regulatory side of things, a couple things came about. One, for home health care agencies, the health department has a new enforcement tool that was passed, permitting them to institute what's called an immediate temporary suspension of a home care license. And this isn't something that I think they're going to overuse in any way. It's just their ability to take over a home care agency if they think the health and safety of home care clients are in jeopardy. They've had a couple instances in the past where they were not able to do that. And they really felt their inability to take over control quickly caused the residents and the clients to be potentially at risk. So we supported that, we negotiated it, and I think it will work well and be used very, very infrequently. Probably the larger issue that arose this session was the use of two bills pertaining to what we'll call granny cams, which is probably the inappropriate term for remote electronic monitoring that can occur in the residences of people. We had one bill related to monitoring within the assisted living or residential home care environment, and another bill specifically targeting nursing homes and the use of cameras in nursing homes. In both situations, we were able to kill the bills with the agreement that we would work together throughout the summer to come up with legislation for the 2017 session that hopefully will cover the issues that we're concerned about, HIPAA issues, control of the images, control of letting staff and residents know that they're being monitored, permission from the clients to know that they're being monitored, all those kind of issues that come into a complicated issue like this. So we're busy working on those sessions. Actually, though, we're meeting this week for the first time, which is the middle of June, to try to come up with something for next session. That's about it as far as regulatory issues. Lots of things going on at the federal level, but at the state level, that was about it this year. So stay tuned.
As Patty mentioned in her legislative recap, the adult training programs will now be reimbursed for their training of nursing assistants after a nursing assistant has been at a facility for 90 days or more. This cost will be added to the nursing facility's external fixed costs. As Patty also mentioned, we now have temporary family health dwellings in Minnesota. This bill was affectionately known as the Granny Pod Bill at the Capitol this session. Essentially, what it is a mobile home that is placed on someone's property so that they have more access to care for a family member who is physically or mentally impaired. Finally, we have an elderly waiver work group that is meeting this summer. The work group is tasked with examining the EW program from top to bottom, finding out what works, what doesn't, and what improvements can be made, both in policy and finance. The work group started meeting earlier in the year, will meet all summer into the fall, and will hopefully help us put together a legislative package for next year around the elderly waiver program.
As Patty mentioned, lots of things happened this year legislatively, but I am going to give you the top 5 working groups. Aaron outlined briefly the Elderly Waiver Reform Work Group. This is a work group that we have organized partly in response to data collection legislation that came forward last year. People want accountability, we want quality, we want to reform the payment system. Aaron Gray gave you a brief outline of that. Number 2, electronic monitoring, or as we affectionately call it, the granny cams. This came out of a Senate passage of a bill that would have introduced some language regarding usage of granny cams or electronic monitoring in assisted living. We managed to talk to folks and convince them that we should have diverse perspectives look at this, and therefore have a working group that brings back some suggestions for implementation next year. That working group will start this very day. Well, actually this week. But depends on when you post this as to whether or not it's this week. Number 3, discharge planning. Swing beds. What is going on as we swing back and forth? This was a response to some legislation that was brought forth last year that was going to alter the current swing bed language. We managed to convince legislators that rather than altering it right now, why don't we have a work group that works together to see if there's some compromise language that can be developed to facilitate usage of swing beds. Number 4, ownership issues, MDH. Raise some issues about who owns what, where, why, and how as it pertains to skilled nursing facilities. We volunteered to have a working group discuss with MDH the various ways things are being owned to try to help them solve some problems that they have identified. And number 5, property. DHS had a report that was 2 years ago in legislation. Then we started some processes as far as going out and getting some appraisals on what buildings are worth. And that process is moving forward. Some of you may have received a letter about that. They will be doing appraisals, coming back with some suggestions, and we continue to be a part of the property working group that will address that in the coming legislative session. Those are the top 5 working groups.
Hi, my name is Todd Bergstrom, Director of Research and Data Analysis for Care Providers Minnesota, and I'm here to update you on the payment changes to nursing facilities coming from the 2016 Minnesota legislative session. There were 4 items of note that you should be aware of. First, the legislature did appropriate $1 million for a moratorium round for nursing facility projects that will fund projects that are greater than $1.5 million or so. You should expect the Department of Health to issue an RFP beginning the round sometime in July of 2016 and ultimately with projects approved sometime later in early 2017. Second, and very important, the legislature and the governor did sign a technical correction to the payment reform retroactive to January 1st of 2016. This technical correction adjusted how the care-related rates were to be judged and was very much needed, so that's good. and that is again retroactive to the January 1st, 2016 nursing facility rates. Third, for those of you who consult statute, you'll be happy to know that all of the nursing facility operating payment rate statute was moved and consolidated to 256R. So sometime later this fall, once the revisor has published that, you will be able to look for rule, statute, and many other items related to nursing facility operating payment under 256R. And then finally, for several years, nursing facilities have been able to consolidate. And by consolidate, I mean 2 nursing homes where one closes. The savings from that closure could be assigned to the renovation and upgrade of the remaining facility. That rate previously to this session was included in the property rate. Beginning, I believe, on January 1st, 2017, that consolidation rate, if applicable, will be moved to the external fixed payment rate. Thank you.
And that is the end of our legislative update for the 2016 session. Coming in 17, we will have new legislators, as both the Senate and the House are up for re-election. So, with that, thanks for watching. Hi there.
Or like this, like just go.
Are we doing inside scoop like behavior or no?